Assalamu alaikum and hello everyone and welcome to today's session on Basic Life Support BLS. I am Dr. Mariam Tahir, physiotherapist, director of PMC Professionals Hub. It is a pleasure to see so many students and healthcare professionals joining this learning session. The aim of this session is to help you understand the latest BLS concepts and the important guideline updates that every healthcare provider should know. Basic life support is one of the most essential life-saving skills in emergency situations such as cardiac arrest, early recognition, immediate CPR, and timely use of an AED can significantly improve a patient's chances of survival. In today's session, we will discuss the key concepts of BLS, the updated chain of survival, including recovery, and the importance of early CPR by bystanders. I encourage all of you to listen carefully, take notes, and apply these concepts in your clinical practice because the knowledge you gain today may help you save someone's life in the future. Let's begin this session. So first of all, we will discuss about introduction to basic life support. BLS is a set of life-saving techniques used in emergency situations when a person's breathing or heartbeat stops. According to the CDC stands for Centers for Disease Control and Prevention. According to CDC, heart disease is one of the leading causes of death worldwide. Many of these deaths can be prevented if immediate help is provided before advanced medical care arrives. That is why learning BLS skills is very important for healthcare professionals, students, and even the general public. So, next is what happens during cardiac arrest. To understand BLS, first we must understand how the heart normally works. So, the heart pumps blood throughout the body. Okay, the heart pumps blood throughout the body. Blood goes to the lungs where it receives oxygen and releases carbon dioxide, CO2. Okay, then the oxygen rich blood returns to the heart and is pumped to important organs such as the brain and other body tissues. So, however, during cardiac arrest, the heart suddenly stops pumping blood. When this happens, when heart stops pumping blood, it happens when blood circulation stops, oxygen cannot reach the brain. The person quickly becomes unconscious. Brain damage can start within 4 to 6 minutes without oxygen. That is the reason why heart stops pumping blood. Okay, this is why immediate action is extremely important. So the purpose of basic life support. The main goal of BLS is to maintain circulation and oxygen supply to the brain and vital organs until advanced medical help arrives. Okay, BLS does not cure the underlying problem, but it keeps the person alive long enough for medical treatment to work. Okay, so next is the chain of survival. Emergency response follows a process called the chain of survival. Each step increases the victim's chance for survival. The main step includes early recognition of emergency and calling for help. Second step may include immediate CPR. CPR stands for Cardiopulmonary Resuscitation. Okay, third step is early defibrillation using an AED. Okay, Fourth step is advanced medical care by healthcare professionals. So, if these steps are done quickly and correctly, the chances of survival increases significantly. Okay, so the key components of basic life support. What are the key components of basic life support? When providing BLS, there are several important actions we must remember. First step is start the chain of survival quickly. The first step is to recognize emergency immediately and activate the emergency response system. This is the first step of basic life support. Okay. Second step is high quality chest compressions. Here, chest compressions help pump blood manually when the heart stops. Good compressions should be fast, strong, and continuous. Okay, this helps deliver oxygenated blood to the brain and vital organs. Third step is use of automated external defibrillator AED. An AED is a portable device used to deliver an electric shock to the heart. This shock can restore and normal heart rhythm in certain types of cardiac arrest. Okay, this shock can restore a normal heart rhythm in certain types of cardiac arrest. Okay, AEDs are designed to be simple and safe, and they guide the rescuer with voice instructions. Okay, and the fourth step is rescue breathing. Rescue breathing basically provides oxygen to the lungs when the person is not breathing normally. It is usually combined with chest compressions during CPR. And the fifth step is teamwork during resuscitation. Here, in many situations, more than one rescuer may be present. Okay, in many situations, more than one rescuer may be present. Working as a team improves efficiency. For example, one person performs compressions, another manages airway and breathing, another prepares the AED. Okay, teamwork ensures continuous and effective resuscitation. Now, the sixth step is management of choking. BLS also includes recognizing and treating airway obstruction like choking. Okay, choking is basically airway obstruction. So, the BLS also includes recognizing and treating airway obstruction. If the airway is blocked, oxygen cannot reach the lungs, which can quickly become life threatening as well. Okay, knowing how to recognize choking and perform the correct maneuver can save a life. So here we need the BLS expert who can recognize the condition on the spot. So for the first topic of BLS, we have the conclusion that in summary, basic life support is a critical emergency skill that helps maintain circulation and oxygen supply during life-threatening situations such as cardiac arrest. You should remember that act quickly and confidently. Don't hesitate. Okay, start the chain of survival immediately. Provide high quality chest compressions. Use an AED when available. Provide rescue breathing and work effectively with a team. Okay, make sure you have a team so that you can work efficiently and effectively and recognize the condition on the spot and can manage the problem as well. By learning and applying these skills, you may save someone's life. So, our next topic is initiating the chain of survival. We will discuss an important concept in basic life support which is called the chain of survival. The chain of survival is a series of critical steps that must happen quickly to save the life of a person experiencing cardiac arrest. Each step works like a link in a chain. If one link is weak or delayed, the chances of survival decreases. Okay, so research shows that early initiation of BLS significantly increases survival chances for patients experiencing cardiac arrest. So we will discuss about the adult chain of survival first of all. When an adult experiences cardiac arrest, rescuers should follow these steps. Step 1 is early recognition and activation of emergency response. The first step is to recognize the emergency quickly. Signs may include the person is unresponsive, the person is not breathing or breathing abnormally. Immediately call the emergency medical service EMS or ask someone nearby to call for help. Early recognition saves valuable time. Second step is early CPR. CPR stands for Cardiopulmonary Resuscitation. In this step, this is basically the second step. Okay, the second step is starting CPR immediately. CPR includes chest compressions, rescue breathing. Okay, chest compressions help pump blood to the brain and vital organs until the heart can start working again. So the third step is rapid defibrillation. The next step is using an automated external defibrillator AED as soon as it is available. The AED delivers an electric shock that can restore the heart's normal rhythm in certain cardiac arrest cases. Early defibrillation greatly improves survival rates. Okay. So, fourth step is advanced life support. After basic interventions, trained medical professionals provide advanced medical care, such as number one is advanced airway management, number two is medications, number three is cardiac monitoring. This step is usually performed by paramedics or hospital teams. Which step? This fourth step, advanced life support, is usually performed by paramedics or hospital teams. So the fifth step is post cardiac arrest care and recovery. This is the final step that occurs in the hospital. Okay, doctors provide what? Doctors provide oxygen therapy, number one. Second is blood pressure management. Third is cardiac evaluation. Fourth is neurological monitoring. This stage helps the patient recover and reduce complications after resuscitation. Now students, let's discuss an important difference about pediatric chain of survival. Emergencies in children and infants are usually not caused by heart problems. Most pediatric cardiac arrests occur due to breathing problems such as airway obstruction, number two, respiratory failure, number three, drowning, number four is severe infection. Because of this reason, the first step in the pediatric chain of survival is prevention. What is the first step in pediatric chain of survival? That is prevention. Steps in pediatric chain of survival. First is prevention. Prevent situations that may lead to cardiac arrest, such as number one, prevent choking hazards. Number two, ensure safe sleep for infants. Number three, supervise children around water. Number four, early treatment of respiratory illness. Prevention is the most important step for children. Number two is activate emergency response system. The second step in pediatric chain survival is activate emergency response. If a child becomes unconscious or stops breathing, number one, call EMS immediately. Number two, ask someone nearby to get help. Third step is early CPR. Begin CPR quickly to maintain circulation and oxygen delivery. For children, rescue breathing is particularly important because respiratory failure often causes the arrest. Fourth step is advanced life support. Medical professions provide number one, advanced airway management, number two, medications, number three, cardiac monitoring. Okay. Fifth step is post cardiac arrest care. The child receives specialized care in the hospital to stabilize and recover. Now, there is an important concept for you guys. You should remember that the chain of survival is only as strong as its weakest link. Okay? If any step is delayed, brain damage can occur. Firstly, and secondly, survival chances decreases. So you should have to do quick recognition, immediate CPR, and early defibrillation are critical. Okay. For this topic, the summary is that you should remember these points. Recognize cardiac arrest quickly, firstly. Secondly, call emergency services immediately. Thirdly, start high quality CPR. Fourth, use AED as soon as possible. Fifth, provide advanced care and recovery support. Now we will discuss about our next topic, that is 2020 BLS guideline changes. So, dear students, we will discuss the guidelines about the 2020 updates in basic life support. So, every few years, international medical organizations review new research to improve emergency care. The guidelines for CPR and emergency cardiovascular care are updated by the International Lion Committee on Resuscitation (ILCOR), International Lion Committee on Resuscitation. These updates help healthcare professionals and rescuers provide more effective and safer life-saving care. Okay. The 2020 guidelines introduced some important improvements and new concepts in basic life support. First step is early CPR by bystanders is strongly encouraged. Here, one of the most important messages in the 2020 guideline is do not delay CPR. What is the important message? That is, do not delay CPR. Many people hesitate to start CPR because they are unsure whether the victim is actually in cardiac arrest. However, research shows that starting CPR early can greatly increase survival chances. Even if the person is not truly in cardiac arrest, the risk of harm from CPR is very low. So, the guideline emphasizes if a person is unresponsive and not breathing normally, start CPR immediately. Do not waste time trying to be 100% certain. Early CPR by bystanders. Early CPR by bystanders can double or even triple survival chances in cardiac arrest. Second step is addition to the sixth link, recovery. Previously, the chain of survival had 5 links, if you remember. The 2020 update introduced a sixth link called recovery. The 6 links now include early recognition and calling for help, second, early CPR, third, rapid defibrillation, fourth, advanced life support, fifth, post cardiac arrest care, sixth, recovery. Recovery focuses on helping patients return to a normal and healthy life after cardiac arrest. This means care continues even after the patient survives the emergency. Third step is post cardiac arrest care is very important. Here, when the heart starts beating again, this is called ROSE. This abbreviation means return to spontaneous circulation. However, treatment does not stop here. Doctors and healthcare teams must carefully manage the patient by firstly maintaining proper oxygen levels, secondly controlling blood pressure, thirdly checking if the patient needs coronary intervention, fourth using targeted temperature management, fifth monitoring brain function. These steps help reduce complications and improve recovery. Fourth step is long-term recovery support. Recovery from cardiac arrest does not end when the patient leaves the hospital. Patients may experience problems such as physical weakness, memory problems, emotional or psychological stress. These 3 problems can patient experience after leaving the hospital. First is physical weakness, second is memory problems, third is emotional or psychological stress. Therefore, the guidelines recommend that survivors should receive long-term assessment and support for their physical, cognitive, and emotional health. This helps improve their quality of life after resuscitation. Fifth step is debriefing after resuscitation. In this step, resuscitation events can be emotionally stressful for rescuers, healthcare providers, and witnesses. These are the persons for that resuscitation is emotionally stressful for rescuers, healthcare providers, and witnesses. The 2020 guideline recommends debriefing after resuscitation. Debriefing means first is discussing what happened during the resuscitation. Second is reviewing what went well. Third is identifying areas for improvement. Fourth is supporting the mental health of rescuers. This process helps improve future performance and psychological well-being. Now, the sixth step is special considerations for cardiac arrest in pregnancy. Cardiac arrest during pregnancy is rare but very serious. The main priority in this situation is resuscitation of the mother. However, if resuscitation is unsuccessful and the pregnancy is advanced, doctors may perform an emergency cesarean delivery. This procedure can save the baby, improve blood circulation of the mother, increase the chance of stressful resuscitation. So this is the special considerations for cardiac arrest in pregnancy. So students, the most important points from the 2020 BLS guidelines updates are: firstly, start CPR early even if you are not completely sure about cardiac arrest, okay? Secondly, the chain of survival now includes recovery as well. Third is post cardiac arrest care and long term recovery are very important. Fourth is rescuers should receive debriefing and psychological support. Fifth is special protocols are required for pregnant patients during cardiac arrest. You should remember early action, high quality CPR, and proper follow up care can save lives. These 3 points you all should remember. Next, we will discuss about Adult Basic Life Support (BLS) and the Adult BLS algorithm. This algorithm is a step-by-step approach used by healthcare professionals and first responders to manage cardiac arrest in adults. Adult BLS is used for patients who have reached puberty or older. Okay, adult BLS basically is used for patients who have reached puberty or older. Okay, the goal is to restore circulation and oxygen supply to the brain and vital organs until advanced medical care arrives. Now, what is the adult BLS algorithm? The adult BLS algorithm is a simple and systematic sequence of actions used during cardiac emergencies. It helps rescuers, firstly, access the patient quickly, secondly, start CPR immediately, thirdly, use an automated external defibrillator AED when available, fourthly, continue life-saving support until emergency services arrive. Okay, this structured approach helps rescuers stay calm and act confidently in high stress situations. So, the first step is ensure scene safety and check responsiveness. Before helping the patient, the first priority is safety. Make sure the environment is safe for both of you and the victim. Examples: first is move the person away from the traffic. Secondly, remove the person from water. Third, ensure there are no electrical or environmental hazards. Okay. After confirming safety, check if the person is responsive or not. Okay. Tap the patient firmly on the shoulders and loudly ask, "Are you okay?" If the patient responds, assess the situation further. If there is no response, immediately proceed to the next step. Now, step 2 is activate the emergency response system. If the patient is unresponsive, you must activate emergency help immediately. Actions include first, shout for help. Secondly, ask someone nearby to call emergency services. Thirdly, ask someone to bring an AED. If you are alone, use your mobile phone to call emergency services and put it on speaker mode so you can start CPR without leaving the patient. Okay. Early activation of emergency services ensures that advanced medical care arrives as quickly as possible. Now, third step is check breathing. Next, quickly check whether the person is breathing normally. Look at the chest and observe for rise and fall. Listen for breathing sounds. Take no more than 10 seconds to assess breathing. Important point for students. What are the important point for students? Sometimes a patient may show agonal breathing, which looks like occasional gasping. This is not normal breathing and should be treated as cardiac arrest. Okay. If the person is not breathing or only gasping, being CPR immediately. If the person is not breathing or only gasping, you should begin CPR immediately. Step 4. Start high quality CPR. In this step, CPR stands for Cardiopulmonary Resuscitation. It helps manually circulate blood when the heart stops. High quality CPR is the most important part of BLS. Correct hand position. Place the heel of one hand on the center of the chest. This is first point. That place the heel of the one hand on the center of the chest. Second point is the position should be on the lower half of the sternum. Okay. The position should be on the lower half of the sternum. Third step is place your other hand on the top and interlock your fingers. Okay. Fourth step is keep your arms straight and shoulders directly above your hands. Okay. This is the correct hand position for CPR. Next is chest compression technique. Perform chest compressions with the following standards. Depth. What is the depth for chest compression technique? Depth is at least 2 inches. 2 inches is equal to 5 centimeter. Okay. Rate is 100 to 120 compressions per minute. Okay. You have to give compressions 100 to 120 per minute. Okay. Allow the chest to fully recoil after each compression. Okay. You should do that at least 2 inches. The depth should be, compression per minute should be 100 to 120, and allow the chest to recoil after each compression. Okay. Avoid leaning on the chest between compressions. Okay. Stop leaning. You have to avoid leaning on the chest between compressions. So, full chest recoil allows the heart to refill with blood, make CPR more effective. You have to allow the chest to recoil, okay? Because full chest recoil allows the heart to refill with blood. That makes the CPR more effective. You have more effective results. Next is ventilations rescue breathing. Okay. After 30 chest compressions, provide 2 rescue breathings. Okay. After 30 chest compressions, provide 2 rescue breaths. Okay. How to provide rescue breath? How to open the airway? Use the hand tilt chin lift technique. Okay. Use the head tilt chin lift technique. First point is place one hand on the forehead and gently tilt the head back. Second point is use 2 fingers under the chin to lift the jaw upward. Okay. This opens the airway. Okay. Then pinch the nose closed. Give one breath over 1 second. Okay. Watch for chest rise. Then give a second breath. Okay. These are the 4 steps after you open the airway. First is pinch the nose head, pinch the nose closed. Okay. Give one breath over 1 second. Watch for chest rise. And fourth is give a second breath. Okay. Avoid giving excess breathing as this may cause complications. Okay. The CPR cycle should remain 30 compressions, 2 breaths. You have to give 30 compressions and after that 2 breaths. Then again 30 compressions, then 2 breaths. Okay. Depth should be 2 inches and compression rate 100 to 120 per minute. So how should you complete this compression rate? First 30 compressions, then 2 breaths, then 30 compressions, then 2 breaths. Okay. Next is special situation. Suspected neck injury. This could be a special situation. Okay. If you suspect a neck or spinal injury, do not perform the head tilt chin lift maneuver. Instead, use the jaw thrust maneuver. Okay. First point for jaw thrust maneuver is place both hands at the angles of the lower jaw. Okay. Place both hands at the angles of the lower jaw. Lift the jaw forward. This is the second step. And third step is open the airway without moving the neck. This is the third step. Okay. First is place both hands at the angles of the lower jaw. Second is lift the jaw forward. Third is open the airway without moving the neck forward. Okay. This technique protects the spinal cord. Okay. A special situation like if one's neck or spinal injury is happened, you have to do jaw thrust maneuver instead of head tilt chin lift. Okay. Now fifth step is use an automated external defibrillator AED. As soon as an AED becomes available, it should be used immediately. Okay. Steps for using the AED. First step is turn on the AED. Second step is follow the voice instructions. Third step is attach the AED pads to the bare chest as indicated. Okay. Fourth step is allow the AED to analyze the heart rhythm. These 4 steps should be used when AED becomes available. Okay. Make sure no one is touching the patient during rhythm analysis. Okay. If the AED advises a shock, first is ensure everyone is clear of the patient. Secondly, press the shock button. Okay. After the shock is delivered, resume CPR immediately, starting with chest compressions. Okay. 30 compressions, 2 breaths. Okay. Sixth step is continue CPR cycle. What is sixth step? Continue CPR cycles. Okay. Continue CPR cycles with 30 compressions and 2 breaths. Okay. Important points for students. What are the important points for students? Keep interruptions in compressions less than 10 seconds. Okay. The interruptions between compressions should be 10 seconds. Less than 10 seconds. Okay. Do not repeatedly stop to check for pulse. Okay. Continue CPR until emergency services arrive first. Secondly, the patient starts breathing. Okay. Thirdly, the rescuer becomes exhausted. These 3 are the points when you can stop CPR. Okay. So, one rescuer adult CPR. What we have learned, listen in this topic is when a single rescuer is performing CPR, remember these key steps. First step is ensure scene safety. Second step, check responsiveness. Third step, call emergency services and request an AED. Fourth step, check breathing and pulse for no more than 10 seconds. For fifth step is start CPR, 30 compressions and 2 breaths. Sixth step is use the AED as soon as it arrives. Okay, seventh step is continue CPR until help arrives. So, so what is the importance of the adult BLS algorithm? The adult BLS algorithm is important because it firstly encourages immediate action during emergencies. Secondly, provides a standardized procedure for rescuers. Thirdly, improves survival rates in cardiac arrest. Okay. Early CPR and early defibrillation can significantly increase the chances of survival. Okay. So, as future healthcare professionals, learning BLS, basic life support, is a critical skill. Okay, this is the final message regarding this topic for you guys, that as future healthcare professionals, learning BLS, basic life support, is a critical skill. Okay, remember, act quickly, start high quality CPR, use an AED early. Okay, continue CPR until advanced help arrives. Okay, your quick response during a cardiac emergency can save someone's life. So now we will learn about two rescuer CPR for adults. Sometimes during an emergency, there are two trained rescuers present. In this situation, CPR becomes more effective because the workload is shared. Okay? According to the International Lion Committee on Resuscitation, teamwork and quick communication between rescuers significantly improve the quality of CPR. Okay? Most people today carry mobile phones, so one rescuer can quickly contact emergency services while the other begins CPR. So, what is the role of the two rescuers? When two rescuers are present, they should divide the responsibilities to provide effective life saving care. Okay, rescuer 1 firstly stays with the patient, secondly starts chest compressions immediately, thirdly counts compressions out loud. Okay, this is the 3 points that is the role of rescuer 1. Okay, first is stays with the patient, secondly starts chest compressions immediately, thirdly counts compressions out loudly. Okay, what is the role of second rescuer? Calls emergency medical services, EMS. Okay, this is the first role of second rescuer. Okay, second role is brings an automated external defibrillator, AED. Okay, this is the second role of rescuer. Okay, rescuer 2, third role is assist with breathing and airway management. Okay, this is the third role of second rescuer, that assist with breathing and airway management. So this teamwork allows continuous CPR without unnecessary delays. So teamwork is more important than individual. Okay, because teamwork allows you to continuously work on CPR without unnecessary delays. Okay, So next is CPR cycle in two rescuer CPR. Okay, in adult CPR, rescuers follow a compression to breath ratio 30:2. Okay, 30 compressions and 2 breaths. Okay, this means 30 chest compressions and 2 rescue breaths. Okay, compression to breath ratio is 30:2. So the 30 means 30 chest compressions and 2 means 2 rescue breaths. Okay, one complete set of 30 compressions and 2 breaths is called one CPR cycle. What is one CPR cycle? It is one complete set of 30 compressions and 2 breaths is called a CPR cycle. It's the one CPR cycle. Okay, so rescuers should switch roles after every 5 cycles. Okay, which is about 2 minutes. Two rescuers benefit is that rescuers can shift their role. One is tired or one's condition is going to be bad. It's better than you are working as a teamwork, and one rescuer do 30 compressions and 2 breaths 5 times. Okay, means first rescuer complete one CPR cycle 5 times and other should shift the role and do same as that of first has done. So they both have can take rest. Okay, rescuers should switch roles after every 5 cycles, which is about 2 minutes. Okay, every 1 cycle and 5 cycle. Okay, 1 cycle is 30 compressions, 2 breaths. Okay, 5 cycles can take 2 minutes to complete 5 cycles of CPR. Okay, rescuers should switch roles after every 5 cycles, which is about 2 minutes. Switching roles prevents fatigue, okay, and helps maintain high quality chest compressions. Okay, if they shift role, the patient can have effective and high quality chest compression rather than the one is tired and doing continuously and one's health is also going down and the compressions effectiveness is also going low. So do teamwork and shift the roles after 2 minutes. 2 minutes is equal to 5 CPR cycle, and 1 CPR cycle is equal to 30 compressions plus 2 breaths. Okay, so work as a team. Okay, so importance of proper chest compressions. What is the importance of proper chest compression? High quality compressions are one of the most important parts of CPR. Okay, high quality compressions are basically one of the most important parts of CPR. So when performing chest compressions, remember these key points. First key point is compress the chest at least 2 inches, means 5 centimeter deep. Okay, compression rate should be 100 to 120 compressions per minute. Okay, 100 to 120 compressions per minute is the compression rate. Allow the chest to fully recoil after each compression. Okay, allow the chest to fully recoil after each compression. Avoid leaning or resting on the chest between compressions. You should stand for straight. Okay, instead of put the load on the patient. Okay, avoid leaning or resting on the chest between compression. These are 4 steps. These are 4 basically key points you should have to follow. First is compress the chest at least 2 inches deep, like 5 centimeter deep. Okay, secondly, compression rate should be 100 to 120 compressions per minute. Okay, Allow the chest to fully recoil after each compression. Okay. Avoid leaning or resting on the chest between compressions. Okay. This is the fourth point you have to. So, if rescuers become tired, they may unintentionally lean on the chest. That is why switching rescuers regularly is very important. So, another benefit of shifting the rescuers to work as a teamwork, you cannot put the load on the patient. Okay, if you shift the rescuer, okay, because whenever the rescuer is tired, he or she shift her or his own load to the patient. So, shifting the rescuer is better than leaning the chest between compressions, leaning on the chest. Okay. So, next is mouth to mask ventilation in adults. Okay, during CPR, breaths should ideally be given using a pocket mask. Okay, steps for mouth to mask ventilation. First step is after 30 chest compressions, place the mask on the patient's face. This is the first step. What is the first step? After 30 compressions, place the mask on the patient's face. Second step is seal the mask firmly. Okay? You should seal the mask firmly. Place four fingers on the top of the mask. Okay? Four fingers on the top of the mask. Place the thumb on the bottom edge. Okay? Make sure you have sealed the mask firmly. Then place four fingers on the top of the mask and place thumb on the bottom edge. Okay. Third step is open the airway using the head tilt and chin lift technique. Okay. Use this technique to open the airway. Which technique is used to open the airway? Head tilt and chin lift technique. Okay. Do not perform this if a neck injury is suspected. Okay. Do not perform this if a neck injury is suspected. Okay. Fourth step is deliver one breath over 1 second. You have to deliver one breath over 1 second. Okay. Fifth step is watch for visible chest rise. Check if the chest is rising while giving the breath. Okay. Sixth step is give 2 breaths, then continue CPR. Okay. After 2 breaths is complete, then give 30 compressions again and then again 2 breaths. Okay. So, proper sealing of the mask is essential to ensure effective ventilation. Okay, proper sealing of the mask is very important to ensure effective ventilation. Okay, so this is the steps for mouth to mask ventilation. Okay, you have to follow these six steps. First is after 30 chest compressions, place the mask on the patient's face. Second is seal the mask firmly. After sealing, place four fingers on the top of the mask and place thumb on the bottom edge. Okay. Third step is open the airway using the head tilt chin lift technique. Or if you suspect neck injury, don't perform this technique. Okay. Fourth step is deliver one breath within over 1 second. Okay. Fifth step is watch for chest rise. Okay. Sixth step is give 2 breaths, then continue CPR. Okay. These 6 steps you have to follow as it is. Okay, use pocket masks. The most important thing, which mask you have to use during CPR? That should be given by pocket mask. Okay, proper sealing of the mask is very important to ensure effective ventilation. Okay, so next is bag mask ventilation in two rescuer CPR. If a bag valve mask device is available, okay, the thing is that if you have available bag valve mask device, it can provide better ventilation than pocket mask. So if you have available bag valve mask device, then it could be a better for ventilation. Okay, in this situation, rescuer 1 performs chest compressions and rescuer stands at the patient head and manage the airway. Okay, this is the benefit of teamwork or two rescuers teamwork. Okay, steps for bag mask ventilation. What are the steps for bag mask ventilation? So first step is rescuer 1 performs 30 compressions while counting aloud. Okay, like 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 and 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, rescuer 1 performs 30 compressions while counting aloud. Rescuer 2 places the mask on the patient's face. Okay, and third point is the rescuer uses the CE hand technique. What is the CE hand technique? Thumb and index finger form a C shape, okay, to seal the mask. Okay, other fingers lift the lower jaw to open the airway. This is CE hand technique that is used by rescuer. Okay. Fourth step is rescuer 2 squeezes the bag to deliver 2 breaths. Okay. Fifth step is each breath should last about 1 second and cause visible chest rise. Okay. These are the 5 steps for bag mask ventilation in two rescuer CPR. Okay. Practicing with the bag valve mask is very important because forming a tight seal can be challenging. So, you must understand the adult BLS algorithm. Okay. Adult basic life support algorithm. Okay, which provides a systematic step-by-step approach during emergencies. It is used for patients from puberty and older who experience cardiac arrest or life-threatening conditions. Okay, so step 1 is ensure scene safety. Before approaching the patient, always check that the environment is safe for both the rescuer and the victim. For example, firstly, no fire. Secondly, no electric danger. Thirdly, no traffic hazards. Your safety is always the first priority. Okay, this is the first step. Ensure scene safety. Okay, second step is check responsiveness. Here, approach the patient and tap the person's shoulder. Firstly, secondly, speak loudly and ask, "Are you okay?" Okay, this is the second step. Check responsiveness. If the patient does not respond, they are considered unresponsive. Okay, so the step 3 is activate the emergency response system. If the patient is unresponsive, firstly, shout for help. Secondly, ask someone to call EMS. Thirdly, ask them to bring an AED. If you are alone and have a phone, call emergency services and activate speaker mode so you can continue assisting the patient. Okay, this is the third step. Activate the emergency response system. Okay, fourth step is check breathing and pulse. Now assess Breathing. Look for normal breathing. Do not confuse gasping or irregular breathing with normal breathing. Okay, you have to know about what is gasping and what is irregular breathing. You should differentiate between gasping and irregular breathing. Okay, don't confuse them. Okay, and how to check pulse? Check the carotid pulse in the neck. Okay, steps to check pulse. Firstly, place two fingers beside the trachea. Slide them into the groove between the trachea and neck muscle. Okay. Check the pulse for no more than 10 seconds. Okay. If there is no breathing and no pulse, begin CPR immediately. Okay. Okay, these are the four steps. First step is ensure scene safety. Second step, check responsiveness. Third step, activate the emergency response system. Fourth step is check breathing and pulse. Okay. Now starting high quality CPR. Here your hand position. Your hand position matters. Firstly, place the heel of your one hand on the center of the chest, lower half of the sternum. Okay, second point is place the second hand on the top of your first hand here. Okay, thirdly, interlock the fingers. Okay, keep arms straight, shoulders directly above your hands. Okay, this position allows strong and effective compressions. Okay.